Hello, I'm Frank Myers. I'm the Director of Infection Prevention and Clinical Epidemiology at UC San Diego Health. I'm here to talk to you about novel coronavirus 2019. And in this case, I can tell you every other coronavirus that we've ever isolated, that we've ever identified, has been spread via droplet mechanism. We at UCSD remain committed to protecting our employees, our patients, and those caring for our patients. So we are complying with the CDC guidelines and currently are using negative pressure rooms, N95 masks or respirators, more accurately, and gowns and gloves. We're also using face shields or goggles. And I think that's a critical point because oftentimes people forget to protect their eyes. And a cough to the face not only exposes your nose and respiratory system, but also exposes your mucous membranes of the eye, which can be a place where the virus may replicate. So let's talk about the PPE for novel coronavirus 2019. As recommended by the CDC, the first step is protecting those eyes. And we're going to do that with either a pair of goggles or a face shield. Our second piece of personal protective equipment will be an N95 respirator. And we're going to be using the size that you've been fit tested for. You can't grab just any respirator. You have to make sure it's the one and the size that you've been fit tested for. Our next piece of personal protective equipment is the gown. Gown is obviously to keep our uniforms from becoming contaminated with coughs and sneezes and the mucus that can be produced by those. And lastly, gloves. We in healthcare, of course, use gloves for almost all of our tasks and are quite familiar with them. This is adequate protection to prevent cross-contamination with novel coronavirus 2019. Now it's time to doff your PPE. Remember, the outside of the gloves are likely contaminated. Grasp the outside glove with the opposite gloved hand and peel off. Hold the removed glove in the gloved hands. Slide the fingers of the ungloved hand under the remaining glove at wrist. Peel off the glove over the first glove. Discard the gloves into the waste container. Now it's time to remove the goggles or face shield after you've performed hand hygiene. To remove the handle, buy the headband or earpieces. Place in a designated receptacle for reprocessing. Now it's time to remove the gown. First, unfasten the ties. Then pull away from the neck and shoulders, touching inside of gown only. Turn the gown inside out, fold or roll into a bundle and discard. Perform hand hygiene before exiting the room. Lastly, we exit the room and then remove our N95 respirator. And remember, the front of your mask may be contaminated, so please don't touch. Grasp the bottom, then the top ties, and remove. Discard in a waste container and perform hand hygiene. These are adequate steps to prevent the transmission of novel coronavirus 2019 from our patients to you, our healthcare providers.